Schizophrenia is a disorder of the brain affecting more than 20 million people globally. First described in detail in the late 18th century, schizophrenia often leads to delusions, hallucinations, and disordered thinking. While treatable, medications for schizophrenia can have major side effects, and there are difficulties with ensuring that patients remain medicated even after symptoms have abated. With complex causes, schizophrenia is a mental illness that is still not fully understood and has been used by bad actors as a method of disabling their opposition. People affected by schizophrenia often seem like they have lost touch with the world around them, frequently manifested through two main categories of symptoms: positive symptoms, where behavior or feeling is added, and negative symptoms, where behaviors or feelings are lessened. Hallucinations are a common symptom of schizophrenia, where patients see or hear things that are not really there. Auditory hallucinations are the most common in those suffering from schizophrenia, and usually take the voices of people close to the subject. The voices are often critical or vulgar and may encourage a person to give in to their own desires. Visual hallucinations are also relatively common, and all hallucinations are intensified by seclusion. Delusions are another common symptom associated with schizophrenia, in which patients hold firm beliefs which are not supported by fact. Delusions may come in four distinct flavors. Persecution, the belief that some others are out to get you, often through bizarre plots or schemes. Reference, a neutral environmental event is believed to have a special meaning, such as a TV figure sending a coded message specifically for you. Grandeur, the belief that you are a famous or important figure such as Jesus. Alternatively, delusions of grandeur may involve special powers, such as flying or telekinesis. Control, the belief that an outside force, such as the American Central Intelligence Agency, is either listening to and broadcasting your thoughts, or outright influencing your mind by adding and removing thoughts. The third main symptom of schizophrenia is disorderly thinking, including unusual thought patterns or disorganized speech. Major disorganization and diminished emotional expression are also core symptoms of schizophrenia. Schizophrenia can also include negative symptoms, which commonly present themselves similarly to depression. Flattened affect is a common negative symptom in which a person does not outwardly express their emotions, or a person may experience a loss of their sense of pleasure or happiness. Schizophrenia can present itself in 5 different ways: paranoid, disorganized, catatonic, undifferentiated, and residual. Paranoid schizophrenia is the most common type, mainly expressing itself through hallucinations and/or delusions. Disorganized schizophrenics have disorganized behaviors, thoughts, and speech patterns, and often show little or no emotion. Catatonic schizophrenia is the rarest type, categorized by sudden, limited movements. A subject may switch often between restlessness and stillness. Undifferentiated schizophrenia is when the diagnosis does not fit cleanly into any of the other 3 categories. Residual schizophrenia only expresses itself through the negative symptoms, with none of the positive. Due to the varied nature of the symptoms and presentation of schizophrenia, diagnosing a patient can be a complex task. Schizophrenia is often diagnosed by a psychiatrist using interviews or assessments to evaluate the person for schizophrenia. They then use the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, to determine if the person meets the criteria for a schizophrenia diagnosis. According to the DSM-5, a person must exhibit 2 or more of the core symptoms, at least one of which must be delusions, hallucinations, or disorganized speech, for a period of 1 month. The psychiatrist must also be able to rule out that the symptoms are not the result of bipolar disorder, depression, schizoaffective disorder, or substance abuse. MRI scans are commonly used to rule out potential conditions such as brain tumors that may present in a similar manner to schizophrenia. A blood test can also rule out substance abuse or interactions between certain medicines such as corticosteroids and cardiovascular treatments. Schizophrenic patients often display symptoms in progressive stages, starting with the prodromal stage, in which a person exhibits a decline in functioning and may display mild forms of psychosis, such as odd beliefs or borderline hallucinogenic experiences. Symptoms will later develop into the more major signs mentioned earlier. Experts in diagnosing schizophrenia are often able to catch these symptoms early and get a patient treatment before their condition gets worse. It is generally accepted that schizophrenia is not a single disease. but a group of clinically and biologically different disorders with common symptoms and treatments. Schizotypal disorder exclusively includes delusions without the presence of the other positive symptoms. Schizophreniform disorder refers to a case where an episode lasts longer than a month, while episodes less than a few days constitute brief psychotic disorder. Schizoaffective disorder is diagnosed when a patient has an episode lasting at least 2 weeks concurrently with a major depressive or manic episode. Schizophrenia occurs on a spectrum, so psychiatrists may determine that a subject does not evenly fit into a certain type or may exhibit a combination of symptoms. Schizophrenia carries risks to the physical health of an affected person, not just the mental health. Life expectancy is reduced by 20 to 25 years as a result of poor lifestyle choices such as a lack of exercise and smoking influenced by schizophrenia. Nearly 40% of people diagnosed with schizophrenia die from cardiovascular disease, suggesting a link between the two. Primary polydipsia, or excessive fluid intake, is also common in subjects with schizophrenia and can lead to seizures, a coma, or even death. Dementia is more common in schizophrenics than in the general population. Women with schizophrenia are half as likely to attend breast cancer screenings, contributing to a shorter life expectancy. Schizophrenia is a major cause of disability. Classified as the 12th most disabling condition, 85% of schizophrenics are unemployed. Schizophrenia also has a much higher than average suicide rate, with nearly 40% attempting suicide at least once. Risk factors for suicide in schizophrenic patients include male sex, depression, high IQ, smoking, and substance abuse. Almost 90% of patients with schizophrenia smoke regularly and generally choose products with high nicotine content. Marijuana is also popular among people suffering from schizophrenia. The cause of schizophrenia is currently unknown. However, the primary theory is inhibited brain synapses. According to the Mayo Clinic, a combination of genetics, brain chemistry, and environment contributes to development of the disorder. Common biological markers of a predisposition towards schizophrenia include a relatively old father and male sex. Exposure to stressors such as bullying and abuse, as well as usage of drugs such as marijuana, amphetamines, and cocaine, exacerbate an individual's predisposition towards schizophrenia. Studies involving twins demonstrate that a genetic predisposition to schizophrenia interacts with environmental conditions in a complex manner to determine whether a subject develops schizophrenia or not. Early exposure to traumatic experiences can influence the development of the central nervous system and cause long-lasting neurodevelopmental changes, altering homeostasis and pushing a subject towards the development of schizophrenia. A leading biological cause of schizophrenia is failure of presynaptic dopamine creation, where the neuron fails to make or transmit the proper amount of dopamine to accurately carry the signal. When the synapses are inhibited by a lack of available neurotransmission material, the signal is degraded and can lead to anomalies such as hallucinations and delusions to be introduced. The opposite can also occur, with too much dopamine being produced and the signal becoming distorted. Glutamate is an excitatory neurotransmitter mediated by NMDA and AMPA receptors, which is heavily involved with cognitive processing. Patients who abuse NMDA receptor antagonists such as ketamine or PCP often demonstrate psychotic symptoms as a result of the NMDA receptor no longer properly processing glutamate. Glutamate and dopamine appear to cause different symptoms to appear in schizophrenics. Disorganized speech and negative symptoms are linked to failures relating to glutamate in the striatum, while positive symptoms are related to dopamine dysfunction. Gamma-aminobutyric acid, or GABA, is a major inhibitory neurotransmitter in the central nervous system. GABA interneurons are central to synchronizing the rhythm-generating networks in the brain. When these networks are thrown out of sync, memory, perception, and consciousness deficiencies may occur. Treatments for schizophrenia often consist of antipsychotics to attempt to reduce the frequency of schizophrenic episodes, as well as therapy to help normalize thought patterns. Antipsychotic medications are usually taken daily as a pill or liquid, although some types are administered as monthly or bi-monthly injections. Many antipsychotic medications carry side effects such as dry mouth, weight gain, restlessness, and drowsiness. If regular antipsychotics do not adequately manage a patient's schizophrenia, they may be prescribed clozapine, a more powerful antipsychotic. Clozapine is generally used as a last resort medication due to the associated risk of neutropenia, a deficiency in white blood cells called neutrophils, which are responsible for fighting off bacterial infections. While the exact mechanism through which antipsychotic medications work is not precisely known, they are thought to alter the levels of chemicals in the brain such as dopamine, glutamate, serotonin, and acetylcholine. Stabilizing the amount of dopamine in the brain helps to reduce errors relating to delusions and hallucinations. Glutamatergic agents are a relatively new method focused on reducing glutamatergic dysfunction to improve negative symptoms and cognitive impairment. GABA modulators are another component of modern schizophrenia treatments, attempting to return proper functioning to the rhythm-generating networks in the brain. Serotonin is also included in many antipsychotics because it reduces the side effects of the other chemicals and has some benefit for negative symptoms. Cholinergic agents are also under research as they stimulate nicotinic receptors in the brain. Nicotine smoking, which stimulates the same receptors, has been shown to have a positive effect on cognition in subjects with schizophrenia. Therapy can also have a positive benefit on people with schizophrenia. Therapy treatments for schizophrenia fall into one of two categories: psychotherapy or psychosocial therapy. Individual psychotherapy can help a person learn to differentiate between what is real and what is not. A therapist can also help their patient deal with voices and hallucinations in a safe manner. Cognitive behavior therapy can help to determine what may trigger a psychotic episode and find ways to reduce the frequency of such events. If a person sees improvement with psychotherapy, it is likely that they will need help learning how to become part of a community, which is where psychosocial therapy comes in. Social skills training focuses on improving communication and social interactions. Because schizophrenia usually develops during the early years of a person's career, rehabilitation is a kind of psychosocial therapy including job counseling, money management, and other skills. The house is glass. It's an illusion. This admiration of mutilation. Historically used as a tool to suppress women, minorities, and Soviet dissidents, many people were falsely diagnosed with schizophrenia and subject to quote-unquote therapies, including frontal lobotomies, insulin shock therapy, electric shocks, and invasive surgery. During the leadership of General Secretary Leonid Brezhnev, psychiatric diagnoses were used to discredit and disable political dissidents. Sluggish schizophrenia was a supposed form of schizophrenia in which the commonly accepted symptoms were unnecessary for a diagnosis. Instead, a sluggish schizophrenia diagnosis was made using the so-called negative axis, which includes symptoms such as pessimism, poor social adaptation, and conflict with authorities. Pro-party Soviet psychologists claimed that people diagnosed with sluggish schizophrenia were quasi-sane and could pass as normal members of society, yet still posed a risk to others. Many critics of the Soviet regime were diagnosed with sluggish schizophrenia and either lobotomized or placed in esteemed mental institutions such as the Gulag system, never to return. Writer Alexander Solzhenitsyn, an outspoken critic of the Communist Party, was publicly against this system, claiming that the incarceration of free-thinking healthy people in madhouses is spiritual murder. It is a variation of the gas chamber, even more cruel. The torture of the people being killed is more malicious and more prolonged. Like the gas chambers, these crimes will never be forgotten, and those involved in them will be condemned for all time during their life and after their death. While the Western world watched in horror as Soviet dissidents were neutralized under the guise of mental health interventions, many American schizophrenics were sent for lobotomy by their friends and family, with varying results. In January 1946, psychiatrist Dr. Walter Freeman pioneered the transorbital lobotomy, also known as an ice pick lobotomy due to the similarity of the tool used. Dr. Freeman would first use electricity to knock the patient unconscious. He would then take an ice pick-like instrument, insert it above the patient's eyeball through the orbit of the eye, hammering it into the frontal lobes of the brain. Next, the instrument was wiggled back and forth to sever the connections between the prefrontal cortex and the rest of the brain. The process was then repeated on the other side. Angeline Forrester witnessed Dr. Freeman's first lobotomy as it was performed on her mother, Ellen Ionesco.
She was absolutely violently suicidal beforehand. After the transorbital lobotomy, there was nothing. It stopped immediately.
Following Freeman's groundbreaking procedure, lobotomies became popular throughout the states, with mixed results. Of the over 40,000 Americans lobotomized, 15% died, and just one-third experienced any improvement at all, with women making up nearly 60% of all lobotomies. Family members sometimes falsely had one another lobotomized in the hopes of getting rid of them, as was the case with Howard Dully. Dully's stepmother Lou, for reasons unknown, falsely claimed that Howard exhibited negative schizophrenic symptoms in order to convince Dr. Freeman to perform his procedure. After the procedure failed to either kill Howard or put him in a vegetative state, he was placed in the care of the government.
I've always felt different. Wondered if something's missing from my soul.
Schizophrenia is a complex mental illness affecting millions of people around the world. Though treatments exist, they often carry side effects that can lead to patients not taking them. The many health risks associated with schizophrenia add on to the mental symptoms to increase the suffering of those affected. With proper care, many schizophrenics are able to live relatively normal lives as a member of their community.
Nice argument, Senator. Why don't you back it up with a source?
My source is that I made it the fuck up.